Hello, everyone. Welcome to our annual licensing event. I am excited to welcome Katie Kimball tonight to speak about licensing requirements and the licensing process in Washington State. Um, Katie has a small private practice, is licensed herself, and also works as a school social worker. Some of you might have met her either in a classroom of ours or as in field. Um, so thank you for enlightening us tonight about all the requirements. Also, the session is recorded and we will make that available after the event. So you don't need to take necessarily all the notes. You can go back and re-listen or look at the slides again. And I'm assuming we will have some time for Q&A at the end.
We should.
So you can put questions in the chat or raise your hand at the end, and we will hopefully have some time to answer questions. If we don't get to anything, we will forward any of your your questions, and then answer it through email. Thank you,
Yes.
Katie.
Thank you so much. I'm so excited to be here. I love kind of coming back and talking to current students at UW-T, our social work students at UW-T, about just all the things that I've learned over the years. So I graduated actually from UW-Tacoma in 2017 with my MSW, and I'm currently working as a school social worker, as Claudia mentioned, in the Bethel School District. And then I do have a small private practice in downtown Puyallup, as well as providing like teletherapy through another company. I really like to diversify and stay busy. So once I graduated, I started exploring the process of becoming licensed. And that is, yeah, we'll talk about that process today. So the good news is that, oops, let's see. There it goes. Oh, there's me. Yes, the good news is that the Department of Health has really maintained their website and continues to keep that updated. So it will be our hub. A few things before we get going. This presentation is definitely informational only. The rules and laws change regularly, and there are ways to monitor those. I'll show you where to monitor those, but I won't really spend a lot of time talking about kind of the things that are coming down. And then, yep, the Department of Health is the authority on all things that we do regarding licensure. And then I just wanted to say, yeah, thank you to the previous presenters as I reviewed their presentations just to create the foundation of what we were going to talk about tonight. And yeah, I think we're ready. So. Okay, so our objectives tonight are to talk about to define the various categories of social work licensure in Washington, the steps to apply for licensure, supervision, and the exam, as well as continuing education requirements, and then some tools and resources. So. Okay, so credentials. So here in Washington, and actually probably yeah, everywhere, there are four different categories or credentials that you can obtain. So the first step is obtaining your associate credential. So we have the licensed social worker associate advanced. And then we have the associate credential, which is the licensed social worker associate independent clinical. And we will differentiate those kind of as we move forward. Your full credentials include the licensed advanced social worker and the licensed independent clinical social worker. Okay, so everything that we do is, of course, mandated, however you want to phrase that, by the rules and the WACs, right? The RCWs and the WACs. So I have those in there because you'll see that, like in June of 2027, there's one that's going to be taking over for another, but there's just slight changes in the language that is used within those. But that's really what we want to reference is the Department of Health and then our RCWs and WACs. And I have links to those kind of as we move forward. But the advanced social work. So advanced social work is the application of social work theory and methods, including emotional and biopsychosocial assessment and psychotherapy. The key difference between advanced social work and independent clinical social work is that next statement, which is under the supervision of a licensed independent clinical social worker. So getting your advanced social work licensure, you still have to work under a licensed independent clinical social worker or psychiatrist, psychologist, psychiatric advanced registered nurse practitioner, psychiatric nurse, or other mental health professionals, which are defined right within the RCW. So individuals who are seeking their advanced social work licensure may not want to work within the diagnostic component of social work. So perhaps they want to work in, case management, kind of that macro level. So I would say that there's less liability within that advanced social work licensure compared to the independent clinical social worker, right? Because you're working under somebody versus independently. So insurance and things like that would probably be slightly different. But yes, so under the advanced, you've got case management, consultation, advocacy, counseling, and things like community organization. Okay, now our independent clinical social work. So both are under the same RCW and can be found, that full definition there, right? But it includes the diagnosis and treatment of emotional and mental disorders based on knowledge of human development, the causation and treatment of psychopathology, psychotherapeutic treatment practices, and social work practice as defined in advanced social work. So it takes that same definition and then it adds in these components, right? Including the diagnosis and treatment. And then treatment modalities include, but are not limited to the diagnosis and treatment of individuals, couples, families, groups, or organizations. So I definitely wanted to delineate those because it's like, well, what am I doing? And why would I need each licensure? So ultimately, the independent clinical social worker credential will allow you to do all the same things that an advanced will. It is supposed to take, like, based on other things that are out there, like less time and other things. However, here in Washington, it does require the same amount of supervision hours. They're just defined a little bit differently. So, but we'll get to that. Okay, so to your associate licensure, that is the first step in the licensure process. So you go to the Department of Health webpage and you apply and you are considered a pre-licensure candidate. In order to apply, you have to have completed your graduate degree. So in this case, your MSW and have already completed that, right? And then you start seeking, once you get your associate licensure, then you're going to start working on supervision and gaining the necessary experience in order to get that full licensure. Okay. So here's kind of the pathway and the things that will be required when you do apply. So this is the information the Department of Health will need. So demographic information, any military status, there's personal data questions. Any other licenses that you have, that education component, right? So again, that Master's of Social Work, the exam is required for full licensure, so not for the associate, and we'll talk about how we get that. And then that supervised experience. So I would recommend, like, straight out, if you have any interest in pursuing licensure, once you graduate with your MSW, I would identify a supervisor and start that process because it's a little lengthy, right? It's going to take years to acquire. So again, sorry, I'm going to repeat myself a little bit, but we'll kind of navigate and go through a little faster. So associate licensure, it's the first step in that licensure process. Yep, and I'm getting ahead of myself, aren't I, as I talk? So completion of an accredited master's or doctoral social work educational program, completion of the application, and they have both paper application and an online application. So the Department of Health is really working hard to make it like streamlined and easy to follow. Yep. And then you do your application and initial licensure fee, which is then sent to the Department of Health. And again, if you do it online, it automatically goes. Other things that will be required. So the fee right now is about $51. And so, when you apply, and then every year you renew that, which we'll talk about. If I click a link, will it let me still go back? Maybe.
Maybe, yes.
Right. We're gonna give it a
It
go.
could be the problem, could be the, yeah, here we go. Zoom
Ah,
did switch.
okay. We'll see. We'll just roll with it here and see. But this is what the application looks like. And this is for your associate, right? An independent clinical licensure. And so it literally walks you through everything that you need. And if you have any questions, there's quick ways to do that. But yep, you submit your application fee, and all of the different components. It does talk about an NPI number. That's one of the things that you just get online and you put in the national provider identifier, and then you apply for that, and it will issue you a 10-digit numeric number. So yep, you'll have all of that information. I just want to make sure that, yeah, so education transcripts. So you do have to submit your official transcripts from your program once you are done. I'm not going to spend a lot of time tonight talking about kind of the out-of-state credential, but there are ways if you are moving and you have a credential from another state to, yes, have that be effective here. They are working on the interstate compact so that our licensure is, yeah, transferable, but that I think it's really state dependent at this point. So, yep, your declaration that you're working towards it and your attestation. So the other components of this, yeah, so you just go through, you're filling it all in, and then you got your attestation of what you're working on, and then the other components should be the supervision, which we will talk a little bit more about, but everything you need is included within the packet. And so you've got, yep, the approved supervisor declaration, right? So in order to submit your application, you already have to have identified a supervisor and have had them complete the form for you. And either they can send it in or you can send it in. But okay, now do I just hit the X? Ah, okay. Good, it worked. All right. So the licensed associate advanced social worker. So, when it comes to supervision, so you've applied for your associate license and now you're starting down the supervision pathway. So for the associate in advanced social work, you need a minimum. And again, this one is a WAC versus an RCW. You've got the minimum of 3,000 hours of supervision. 800 hours must be in direct client contact. 90 hours must be in direct supervision. So 40 of the hours are in one-to-one supervision, and then 50 hours may be in one-to-one or group supervision. And whoever you choose as your supervisor will meet certain criteria and they will be aware of this information. Yeah, tracking it though will be up to you. And so coming up with systems and ways that you want to track things. But again, you can't start tracking hours until you have that associate license in hand. So for the licensed independent clinical associates, it's the minimum of 3,000 hours. So again, the same hours over a minimum period of 2 years. So in this case, you can't accrue them like as quickly as you can, right? So in the previous for advanced, you can move a little bit faster. I still need the same amount of hours, but one can go faster than the other. So this one takes a little bit longer. 1,000 hours must be in direct client contact. So there's an increase there by and supervised by an LICSW. 100 hours must be in direct supervision, 70 hours must be supervised by an LICSW, and 60 of the 100 hours must be in one-to-one supervision. The remaining hours can be in one-to-one or group supervision. So this feels more complicated than it is because it's like, how many hours do I need and what does this look like? But don't worry, like you break it down, you start accruing your hours and then your supervisor will know this information. And so after the 70 hours, the remaining like 30 can be done by another licensed mental health professional that meets the WAC requirements. So if you are working within, let's say you're working within community mental health and there is, a marriage and family therapist, a licensed marriage and family therapist who can supervise that final 30, you can utilize other mental health professionals. Again, you're just going to refer to that WAC. So, all right, let's see. So, yep. So here's those supervised postgraduate experience requirements. It really does break it down and it'll define it for you. And then as you have questions, you just click that whack to find out like, okay, who really qualifies to give me this? The DOH now has kind of a database of supervisors that is easy to access. So you can go through the list and see who provides it in person, who's providing it like via Zoom or via telehealth or those kind of things, and who's providing group, and so and what area they're providing it in. So there's a whole list now in database so that it's easier to find, which is nice. And then this is the verification of social work supervised your experience. So once you've completed your experience, you're going to be submitting this. And it documents all of the dates, right? And then you're going to want to keep some sort of documentation around. So for me personally, I kept a calendar, right, of all of my direct service hours and what that looked like. And so I printed those calendars to total my 3,000 hours, and then went through and totaled. I definitely could have had a much better way of keeping track of that. So I highly encourage folks to think about it ahead of time, just how they want to track those hours and yeah, and what they want that to look like, right? Because when the time comes, if you have to provide evidence of the completion of hours, you need to be able to do so. So, and then you'll keep those records. Okay. There it goes. So licensed associate. So associate licenses are valid for 1 year and have to be renewed every year on or before your birthday. So the way the state has it set up, once you apply for the first time, regardless of whether it's around your birthday or not, but your renewal will typically be your birthday. And that'll be on your associate licensure. So, and at that time, and it'll prompt you, it'll send you information when it's time for renewal, but you'll submit your renewal fee and affidavit of compliance with the continuing education requirements, which we will talk about. And I believe the fee is a little bit less for the renewal. I want to say it's like $41, but that again is subject to change. So here on the Department of Health website, you've got, oh, this isn't the one I wanted. Well, it is helpful in the sense of like, here's all the rules, right? The things that are coming up and the things that are changing. And you can literally track it now. So you can go rules in progress, and then you can have notifications sent to you. You can also get involved in it if you want to be involved in kind of the changes that are upcoming. But you can kind of see what's coming down for us and what that looks like. One of the things that I found interesting, so though I've been licensed for many years now, I had not received notification about the HEAL WA. And I do have a link I think I have a link to that. If not, I'll provide one. But once you become licensed, you have access to part of our fee then goes to the HEAL WA, which is a database connected to UW that has lots and lots of resources for lots of different types of providers within the state. So I believe that was, as the need for licensed practitioners increased, they started adding in different supports, right? So they were trying to streamline the credentialing process, which it's pretty clear here on the DOH website. So as you are navigating that, really does break it down. Sometimes, you might be looking for something specific and it could be a little harder to find, but I promise you it's in there. Okay. So your full licensure. So upon completion, so once you have your associates and you complete all of your hours and you submit a new licensing application, and that will be either, based on what it is that you got your associates in, right? So your advanced or your independent clinical. Once your licensing application has been accepted and approved by the Department of Health, you'll receive instructions on how to register for the exam. So sometimes people want to, and actually they now allow you to take it, I think, a little bit before you've completed. So that WAC or RCW had changed after COVID, I think, as a way to like expedite the process because it is time consuming, right? It takes a while to get those 3,000 hours. And so several years later, after doing all of that, you can now sit for a test. Yes, which feels very daunting and feels like it has lots of pressure. However, there's lots and lots of resources for the exam itself. And I don't think it's ever too early to start kind of preparing and start kind of just reviewing that information. One, it's just a great refresher for you as you are reviewing it based on like theory and, depending on what it is. It also allows you to like explore different modalities, right? And different medications and I think different aspects that I don't know that are yeah, getting my master's really prepared me for, right? Like because it's that deep dive, right, into preparing you for that exam that you're going into kind of that social work component. So, okay, the exam. So once you get approval to sit for the exams are administered by appointment at designated test centers only. And you must pass it's the ASWB, so it's the American Associate of State Social Work Boards exam. Advanced social workers take the Advanced Generalist exam, and independent clinical social workers take the clinical exam. Exam scores are sent directly from ASWB to the Department of Health, and then after that, full licensure is issued. When you do complete the exam, they do give you a printout of whether or not you passed, and then the areas, right, of what you scored. And so, yeah, it's not uncommon for folks to not pass the first time. So I like to kind of put that out there, right, as we're preparing, because it does require really specific knowledge. So, but there are lots of different ways to study for that. Okay, continuing education. Both the associate licensure and fully licensed, right? Once you are fully licensed, both require that continuing education. So for associate social workers, you must complete and maintain proof of 16 hours of continuing education every year. And the way that you attest to that is when you are renewing your associate license, there's like an attestation essentially that you are completing those hours. At any point, they can ask you for the documentation of those hours. So you do want to make sure that your record keeping is kind of, on point, similar to kind of how you're tracking your hours. You've got documentation of your continuing ed. And the WACs and the RCWs for that are actually very clear on what we need. And I think I have that one linked because I wanted to show you guys. So for fully licensed social workers, so once you do have your license, you must complete and maintain proof of 32 hours of continuing education every 2 years. Of the 32 hours, 6 must be in ethics. That was added several years ago. And so we've started to see more trainings that center around ethics for that reason. And there are some additional requirements for continuing ed. And so that is why I linked it. Because as I was reviewing the WAC, so at least 6 of the 32 hours must be in professional ethics and law, which may include topics under the RCW. At least 2 of the 32 hours must be in professional roles and boundaries. So yeah, and so it's very, very specific as you're seeing here. So yep, and boundaries, these hours must be taken separate from the requirements and in the other subsection, right? So taking one training that includes ethics and and boundaries and professional roles. No, they want you to take 2 separate trainings, right? And those things and acquire those hours separately. Yep. And yeah, health equity has also been added. So you see that within C. And I would say that within continuing education, this is where I've seen some changes, right? Originally, it was the 32 hours. Then they added in the ethics. They're adding in some more specific information. So you definitely want to refer to that. But the Department of Health it'll link that for you, right? It'll let you know, like, okay, these changes are coming. You just want to make sure that you are receiving that information. So. Okay, tools and resources. Okay, I am flying through this. So we're going to have plenty of time for questions and just to talk about social work if you want. I only linked 4 because I don't want to overwhelm anybody. And these are the 4 basic ones that you need, right? So we have our RCWs, which are very specific. And again, they are RCWs, right? Title 18, 18.225 .0 10. And this right here is an example of what I was talking about earlier about how it changes, right? So the current definition is effective until June 30th of 2027. And then there is a new definition, which is effective June 30th, 2027. It is very, very similar. There must be like very minor changes because the definitions have been the same as I was reading it through, but clearly there's just slight changes in wording or other things like that. But again, referring to those RCWs, the rules, and then of course referring to the WACs. So, but I linked those so that you can kind of keep track. Yep. And then I do have the WACs here as well. So WACs to reference, just as a starting place, are this one right here. So 246-809. And then you can go through, right? And you can see, okay, what is required? How is it defined? And if you are early in this process and just wanting to explore, I think becoming familiar with the WACs is a great place to start, right? The WACs and the rules. Because yeah, this is the foundation, right, of where the Department of Health then takes over. And as things are changing, or if you have specific questions on that continuing ed, like we talked about, it will be defined here. So along with fees as they change. Okay, I already had shared numerous times what the Department of Health website looks like, and literally they have made it so streamlined. It's so nice. It wasn't always like this. And so yeah, we've got apply for license, right? Verify licensing requirements. Boom, boom. Like everything is there. And it literally, as you scroll down, you can check your status. And then you've got down here, they've got learning sessions that you can attend, how to practice with a pending associate license. So that is something newer, right? So if your license is pending, right? So literally, yep, October of 2025, as long as you are under supervision, right? There's some updated rules about when you can start. So once you graduate, if you're starting that process, I did work with my associate license. I worked under a licensed mental health counselor, and yeah, I was able to start kind of acquiring that the clinical like skills that I needed. And that was super helpful. Okay, and then I am skipping over tonight, like substance use and other credentials that are available, and just really focusing on our LICSW and yeah, the advanced. So, and again, there is more. And then, yes, and all along here, you're going to find exactly what you need, right? So again, watching those, if you're out of state, here's that supervisor directory that I kind of mentioned. See if it wants to, there it goes. Yep. So again, it goes over the hours of what that looks like. And then here is the directory. And you can break it down by kind of your interest and what you're looking for when it comes to a clinical supervisor. So, yep. And you've got lots of different folks who you can kind of review based on your area. You can look at their population served and lots of, yeah, and the things that they're willing to supervise. So this individual, it's interesting, right? So here they are, they're an LMFT. So they, in this case, could say you were pursuing your licensure as an independent clinical social worker. This individual could supervise about 30 of your hours, right? So there's different ways to acquire those hours. And each time, if you do switch supervisors, you do a new form and you submit that to the Department of Health. So you will see a very comprehensive list here of supervisors within our state. So I did go ahead and link ASWB because they are the ones, right? They put on our exam. And so when you are starting to study for the exam, this is a great place to start. They're going to give you resources. There is a massive book that you can purchase. Oftentimes within your cohort, you'll find after you graduate that cohorts will share the book, right? So somebody who has already passed will then pass it along to somebody else. So however you all are connecting once you graduate, lean into each other when it comes to that experience and when it comes to finding like a supervisor. Because yeah, that's how I find my supervisor was through others within my cohort and just maintaining that contact. And then we shared books. There's also a couple other resources that I will mention and I'm happy to provide. There's one that is incredibly helpful. It's all that I did in order to pass the exam, and I passed the exam first time, so I highly recommend it. So However, as you're preparing, there's lots of different ways that you can prepare. So starting with the ASWB website, there's apps that are available and free for studying, and for starting to kind of explore what content might be on the exam. So if you, again, are early in that process, that would be a good place to start. Yep, is looking up the apps that are available and then kind of navigating that website as well as talking to your peers. So yeah, I'm happy to talk about questions. Yeah, you guys are ready.
Thank you. That was comprehensive. There is one question in the chat.
Right.
Oh, or two questions now.
Yeah.
So I will start with the first one, and already it says I have a pretty specific question, so I don't know if we will be able to answer.
Okay.
My husband is active duty military. I know that you said that it is state dependent,
Yeah.
but if I started the process of gaining supervision hours and then had to move, would I be able to continue to work towards licensure in Washington State, even though I am in a different state? I plan on working for the VA and plan on receiving supervision from the VA here and then the VA where I move to.
Yeah. Yeah. No, that's a wonderful question. So the answer to that is yes, you can be licensed in multiple states. In order to serve clients within that state, you have to be licensed in that state. So, for example, if you are on something like BetterHelp or one of the online platforms for, providing therapeutic services, and it's based on where the client lives, right? So let's say, not necessarily based on, yeah, where the client lives and where you are licensed. So you can become licensed in multiple states. So an example would be like I'm licensed here in Washington. I can become licensed in California and serve clients in California and other places. So it might not be transferable. However, well, it depends on the state that you move to, um, based on the interstate compacts and the different things that are happening. However, you would still be able to serve individuals within Washington if you are licensed in Washington. So,
And then I guess while working towards licensure, even with the associate, I couldn't serve clients that are outside of Washington if I only have an associate license for Washington State.
ooh, good question. Okay, so if you have your associate license and you are under clinical supervision here in Washington, or under supervision here in Washington, and you're serving clients in Washington, I think there's a way that you can do that. Yes, so all of those things would need to be met, right? They need to be clients here in Washington, individuals who reside here. You would have your associates here in Washington, and your supervision would be here in Washington. And I think too that would come down to your supervisor as well, and kind of their how comfortable they are with that. So considering that if this is the individual who's considering working or going to work for the VA, they are definitely going to have that flexibility and know people who are willing to do that, typically, because it's a need right across the nation. So yeah.
But then they would probably have to apply for the license in every state. Is that what I hear you say?
Yes. So though individuals up above us, right, on that macro level are working on the intercompact and like state agreements from state to state, it really still is state dependent. So based on the state that you're moving to, I would look at just as I showed you on that Department of Health website where it said out of state applicants or things like that, you're going to want to explore, right? Like what does it take to become licensed there? And will they accept a license from another state, or do I need to go through the process? Now, typically you don't need to take like the exam again, right? That's across. However, so that's transferable. It'd be the hours of supervision and those things within that particular state. But most of the time there's a way, right? There's a way so that you can work within other states because there's a lot of people who want to do that. But the thing that comes to mind as we're talking about this is like teachers, right? So teachers and teaching credentials, oftentimes they then have to get the credential within that state, right? So they might sit for that exam or those kind of things. But this is a great thing too to talk to your legislators about and kind of as you're getting active, right, within NASW and other things as you near graduation, really kind of looking at like, well, what is happening, right, with these interstate compacts and what is transferable and how can we work in other states and make their requirements streamlined so we can serve more people. So, yeah.
And I saw your hand up. Do you want to say something directly to the question?
Hi, yeah, sorry.
Yeah.
So it's just really, really complicated because within federal service, I hear, oh, it doesn't matter what state you're licensed in. All the VA cares about is that you're licensed and they can take it with you to any state and it just doesn't matter within federal service. And so I was trying to look online and saw like some of that language, like as long as you're serving people within Washington State and Washington State supervisor, and so it's just really really confusing with the like with what you can do with the associate license and how portable it is. So I'll have to continue going down the rabbit hole with that. But I do really appreciate you taking the time to answer my question. And it's a relief that there's at least some wiggle room, and I just hope it gets better over time.
And they are working towards that, right? Like the proverbial they, right? But people are working towards that, right? Because there is such a need for providers. The VA may have other like standards, right? Because individuals, let's say, yeah, they may have their own set of requirements because they're federal, right? Versus kind of being state. And so, yeah, and it's then a federal service and perhaps funding wise. So yeah, because then you get into things like billing, and that's really right. So you're licensed, and they're looking at where we're licensed, and then you're going to be credentialed right within that particular insurance company, whether it be TRICARE or other things like that. Yeah. So, yeah, that definitely a VA specific, I would say.
Thank you.
Yeah.
And Cameron is asking, what does the exam look like?
Ooh, yes. So I will say I was, of course, petrified to take the exam. By the way, I'm just very transparent about those things. And so I prepared, but I didn't prepare as much as I should have. I think it was my way of, yeah, kind of that like, if I don't do well, then I can blame it on the fact that I didn't fully prepare kind of thing, right? So yeah, it is, you sit, I'm trying to remember how many hours you sit for hours. So you go, you're going to book that appointment. I drove up north in order to take it. It's a very specific testing site, and there's very specific rules within that testing site about when you can take breaks and what you can do. You're given a whiteboard. You're sitting in a cubby, your own little cubicle. And there are people around you, but they are taking, I think there was maybe one other person taking the same exam as me. Other people are taking lots of other types of exams. So it's just a big testing center. But again, very like rigid and specific. I will say what worked for me is, yeah, and then you go through, it's online, right? So it's not a paper version. And then you're going through and you're answering those multiple choice questions. So it is multiple choice. And as you look at the ASWB website, it'll break it down by category, right? So there were specific, because I'm an LICSW, of course, it was geared towards clinical. So I had very like clinical questions. And so I did have to go back, right, and review theory and review a little bit on medication and, just that general knowledge of things. However, don't you worry, like you can prepare and yeah, and you'll do just fine. And you can take the test again. Right. So if folks don't pass the first time, yeah, you just take it again. I will say what worked for me was drawing my circle of control at the top of my paper, and like just sitting and breathing and then using my break. I think all too often, right, we just want to get through things and, we don't like pause and really settle ourselves because you have the knowledge. You're going to prepare, you're going to be equipped. But in that moment, we get in our head, right, and we second guess everything. And you can like skip questions and go back to them. So that's on there, and they give you a little whiteboard that you can write on as those things come up. So yeah, was it a 3-hour test? It was something along those lines. Yeah. I can go back and look at those specifics too of how long it takes. But I know that that has changed. And even the printout that they give you at the end, it has your picture on it, and then it tells you what categories you scored in, and then whether or not you passed. Now, for those of us who tend to be like high achievers or overachievers, passing is passing. Nobody is going to ask you, like, what score did you make on it? You either passed it or you didn't pass it. So know that like there's some relief there, right? It's you don't have to get 100%, right? I want to say it's like 70. So or yeah, and it tells you exactly how many questions you can miss and what that looks like. So yeah.
Thank you.
Mm.
And then can you have two different supervisors at the same time? For example, what if your job offers supervision, but you also want to find a supervisor on your own who specializes in an interest of yours? Is it possible to accrue hours from both supervisors?
Yes. So, yeah, I think within, so let's say you're working within community mental health and you're working with an LMHC, they can only do so many of your hours, right? That will count towards your licensure hours. So if they're not an LICSW, right? And again, I'm talking specifically to the LICSW, versus the advanced. But yes, so you can have two different supervisors. You're going to submit that form for both of them. So both are going to agree that they're going to teach you the basic things that they're supposed to teach you, right? Which have to do with like, yeah, your record keeping and different factors that are outlined within the document that they sign and submit. So, and they're attesting to in that document, they're attesting to the fact that they meet the criteria, right? They've are post, they've had their credential for several years, and they meet this very specific criteria in order to supervise. And you do always want to verify that, if you can, right? Like you have that information, right? They're telling you like, okay, I do qualify based on X, Y, and Z. You do want to have that. So I think the other thing to ask them, so in my experience, I had, yes, someone who is like grandfathered into the supervision process and into licensure. And she was wonderful, and very affordable. However, yeah, she was aging and started to experience some health things. So I think asking them like, well, who's your backup? Do you have a backup if you're not available? How would I access my records? Because ultimately they're going to sign off that you've met all those supervision hours. And so asking questions about that can be really important, and just having like knowing their backup system, and what that looks like. Most will keep very detailed record of your supervision, and so in various formats, and can speak to that, right? And will advocate for you, if, let's say, DOH has lost the form or something like that. Many will kind of go over and above to like contact DOH and advocate in that regard. So yeah, and I think, just like in clinical practice, when it comes to finding like a therapist or, a counseling provider, it's all about that goodness of fit, right? So it is okay if you start with a supervisor and then need to switch to another. Again, you'll submit that form every time, because you have to have a clinical supervisor or have a supervisor, right, when you are going through and accruing those hours. However, it is all about goodness of fit, right? So if that's not the person for you, you can switch at some point. You don't have to stay with that one particular person. You'll also find that different supervisors charge different rates. So some will charge exactly what they charge for like therapy services, right? What they would charge a client coming in. You will find those within group. Group is a great way to have a shared cost. And to share information with one another. I think it was during COVID when I was, yeah, pursuing licensure. And so we had a lot of Zoom, and we also did a lot of group as well, but we did a lot of case consultation together, as well as exam prep. So I think, depending on the supervisor, it can look how you want it to. So you can ask them beforehand, right? Since we have this amazing supervisor directory, you actually have the ability now to kind of, vet that a little bit and find out if that's a good fit for you. Before that didn't exist. And so a lot of it was kind of like word of mouth, right? When you were trying to locate somebody who can provide those supervision hours. So, yeah.
Thank you. Um, these were all the more licensing specific questions. Is anybody is on the call that has a question? Feel free to raise your hand or just speak. You don't have to type it in. Or yeah, if anybody else wants to add something in the chat.
and I'll have my contact information for you as well. I'm happy to answer questions. Yeah, one of my favorite things to do is kind of work with those coming out, right? So whether it be my interns or my practicum students, really like providing them the things that I didn't necessarily feel equipped to do. And so, yeah, if you have any questions, feel free to reach out. If I don't know the answer, I generally, yeah, we're social workers, right? So we know somebody who does. And so, yeah, I will help you locate somebody. Yeah. And I will say right now, in order to get your ESA, so if anyone is also interested in school social work, the ESA or Educational Staff Associate, once you graduate, it still currently does not require an exam. So I will be frank, that was my motivator coming out of school. I was like, I'm just going to go ahead and get this because I don't have to take an exam, right, in order to get it, which is, there's pros and cons to that, right? When it comes to like, yes, who we're putting into the field. However, for somebody with test anxiety, it was definitely helpful. And so I got my ESA. And then, yeah, I really, the thing I love so much about social work is the fact that we can do so many different things, right? If you do want to work in hospitals, for example, most want you to have that LICSW. And the reason being is that you can then diagnose, you're doing notes, and you can bill insurance, right? So that would be if you are looking into hospital social work, that is often one of the requirements, or they want you to have it within a certain amount of time, right? Or be under supervision. As one of somebody who's here was talking about that some employers can provide supervision or do provide supervision. You just want to make sure that it fits within the WACs and the rules, right? Those RCWs around kind of the supervision that you need specific to social work. So yeah, be really specific. I did know somebody who got caught in that, right? They had somebody who they were told they could supervise them, but come to find out their credentials didn't match or line up like they could. And they could supervise a certain amount of hours, but not all of the hours the person had already accrued. And so they had to then start over with that. So yeah, because the Department of Health isn't going to double check, right, that the supervisor is qualified. That onus is on that particular supervisor as well as you to ensure that that person is qualified to supervise. Now with the directory, it makes it a little bit easier, but there are individuals who qualify to supervise who are not in the directory, right? So an example would be like, I'm not necessarily listed in the directory yet. However, right, I've completed the necessary requirements to supervise within the field. So yeah.
Thank you.
Yeah, no.
General question, and Ryan already answered, but I want to repeat that. So it has been recorded. We will send out the recording plus the slides as well. So if people just want to independently look at the slides, I'm right, Katie? We can
Yeah.
also. Yeah.
Yep. I will. I got to fine tune one because I was adding in a
There we
link.
go. Yes, you
Yeah.
fine tune
Um,
and then just share them with us, and then we will
yep.
send it out together with the recording so people can also go back to the contact.
Yep. You betcha.
Thank you very, very much. This was
Yeah.
super helpful. And it sounds like the chat is exploding as well with thank you.
Oh,
So,
yes.
and anyone who was in this event tonight or watches the recording, if you have a question, let us know. We're happy to forward it if things come up, or you have the contact also directly on the slide. Yeah, if things come up later.
I am
And
happy to continue to support anyone within our field as they navigate, yeah, this process because it feels very overwhelming. However, yeah, now with the DOH website, it's streamlined it a bit, but I can understand that there's still lots of questions, right? It's like,
yeah.
where do I start? So yeah, wonderful. Well, thank you guys for, yeah, having me and allowing me to talk about my favorite topic, social work. I'm always happy to do that.
Yes, thank you so much. And I hope everyone has a good night and a good rest of your week.
All right.